All right, good afternoon, everyone. Welcome to the second biannual Curated Collisions event series at Northeastern University. We're really excited about the lineup that we have here for you today. It's an incredible lineup of both the panel presentations, but also the breakout sessions. And that's really where all the action happens in the breakouts, where you get to meet each other, talk, and so on, and exchange those ideas. And so we are super excited. Today, we have 170 plus registrants. They'll probably come in and out during different parts of this 3-hour event. They're from, what I learned just recently, from 21 different states, from 17 different countries. So really getting a really great spread of these ideas. And I think that's really going to be exciting and add to the exchange of ideas that we can have today together. So really, really excited about this. As you know from the agenda, there will also be some pitches in the middle of these events from startups that we have, and we have them here with us today. In addition, all of you are here actually to interact. It's not about the main stage. It's not about whether you're a lead discussant in the breakout sessions. We're really grateful for those of you who are doing those roles, but we're also here because all of you have something to share with one another. And so that's really part of what Curated Collisions is all about. So what is Curated Collisions? Curated Collisions is our flagship networking and knowledge share event that the Health Science Entrepreneurship Program at Northeastern University's Bouvet College of Health Sciences puts on. That's a mouthful. And what that is that we've been really trying to think about ways in which we, as an academic institution at Northeastern University, thinking about health at interdisciplinary boundaries, and think about bringing people together in our communities. Whether that is today, it's not just Boston anymore, our communities is a global community. And what we want to do is bring together thought leaders and experts, academics, and people from all ranges of abilities and kind of skills to come together and really think about what health and wellness can be. And we sometimes do this around themes. This time's theme is around AI and health and wellness. Last time it was transformations in healthcare for 2020, looking beyond into 2021. We'll keep changing these kinds of themes based on things that are really interesting. And we want your input to figure out what those interesting themes are that you're grappling with, that you're thinking about, so that we can collectively put our mind share together and solve these big, big problems. And so why now? The speed of change is for all the things that are changing in the world around us. We know that on the flip of a dime, we all moved to virtual, right? A lot of things happened in this last year that wouldn't have happened in like a decade. So it's really important for us to bring people together to actually share these ideas of how we're adapting to the time. Why you? Well, innovation doesn't happen in a bubble. Many of you are leading major organizations. You are starting your own organizations. You're at the brink of your career in some of these places or at the start of their career. And what we want to do is make sure that we bring together these different perspectives rather than thinking on our echo chambers. Unfortunately, this one is still virtual. Hopefully the next time we can all be in person. And so why HSE is because, what I said is innovation is a daily practice. It's about listening, it's about pitching, it's about experimenting. And that's what we want to do. It doesn't happen in a vacuum. Why Northeastern? Well, for that, I want to introduce our Dean Carmen Skepa, who is a physician and a public health specialist or expert. And she's going to tell you more about her unique perspective about why AI matters in health and well-being. Please, Skepa.
Thank you, Rupal. It's very nice to be here. As Rupal introduced me, I'm Carmen Skepa, Dean of Bouvet College of Health Sciences, and it's really wonderful to be here with all of you, and good afternoon and welcome. I'm really excited to be among you today, not only as Dean of the College, Bouvet College of Health Sciences, but also as a clinician and a researcher interested in transforming the future of healthcare. My own research program in gerontology has focused on understanding the interplay between biology, lifestyle, and environment, and their impact on quality of life for older adults. Notably, my work has examined the role that precision health approaches play in prolonging health span, and by that we mean life lived in good health despite the presence of risk factors, disease, and disability. And at Bouvet College of Health Sciences, our vision is to be the leaders in shaping and driving the transformation of healthcare to health span. This, we think, is a proactive, people-centered approach to health, which contrasts with the more reactive style dominating much of today's healthcare system as we know it. And we are recipients of it or delivering it in some ways. It all allows us to better understand and take advantage of the intersection of human biology, technology, data, and personalized care. And altogether, this interplay will result in better understanding of and care for the individual as a whole, rather than thinking about the condition or being a case. We believe that the successful integration of artificial intelligence, AI, in our teaching, research, and practice is critical to achieve this vision. AI can serve as an essential conduit to improve health outcomes for individuals and their communities through enhancing data sharing, collaboration between patients, providers, and payers, not only with respect to diagnosis and treatment practices, but more importantly, around primary prevention. A desire to help drive the collaboration is really what brings us here today, as Rupal mentioned. It really is the opportunity to collaborate and think about what future opportunities there may be and how we may purpose or repurpose what we're doing today. Through this shared expertise and leadership in these areas in AI, digital health, and innovation, Northeastern University, Bouvet College, and our Health Science Entrepreneurs Program are strategically placed to convene today's gathering and foster ongoing conversations, which I can't wait to hear about. I have had the pleasure to meet many of you speaking today, either as panelists or as lead discussants, and I look to interact with all of you participating today. This was, we made sure to have this opportunity to connect before today's event, but I know that the conversation is going to be very inspiring, and we really have something great in store, especially around networking. So I look forward to actively participating in the session and hope to continue to engage with all of you beyond this event. So thank you for being here, and Rupal, I'll pass it back to you.
Great. One thing I failed to mention is who I am. My name is Rupal Patel, and I'm a professor here at Northeastern University, both in Bouvet College of Health Sciences as well as in Cooley College of Computer Science. I'm also the founder and CEO of a company called VocaliD, which creates personalized individual voices for text-to-speech. And so along with, and I'm a board member of the Health Science Entrepreneurship Program at Northeastern University. So it's my pleasure to introduce to you the first panel, which is going to be on the hospital network-led digital health and wellness innovation. Now, what we have is two panels. This first one is hospital network-led innovation, and the second one is industry-led innovation. And I'm going to be your moderator throughout, and so your event lead throughout this process. So it's my pleasure first to introduce to you Robert Schultz. Robert Schultz is an NU graduate. He is the moderator of our first session. He's an entrepreneur. He's a professor at NYU in entrepreneurship. He's also an innovation ecosystem builder. He's the founding manager and managing director of Massnex, which is a life science diplomacy agency that aligns the incentives of industry, academia, government, and philanthropy to advance patient advocacy. He's a graduate of the Massachusetts Biotechnology Council called MassBio and MassConnect program, where he's developed his patient-driven strategy in collaboration with the cystic fibrosis community. Again, Robert Schultz, you're going to get to introduce the panel, and we're really looking forward to this really fascinating panel.
Yes, wonderful. Thank you so much. It's such a pleasure to be back at my alma mater and to be able to serve in such a capacity, to be, again, a connector and an ecosystem builder. As you mentioned, my client base is more or less global, helping them to connect the dots inside of the Boston ecosystem. And so this is very nice to be able to actually introduce the audience today to some of the leading experts who actually represent these hospital programs, and to be able to actually hear straight from the source some of the best practices. So I'm really excited today to be able to introduce our panelists. First, we'll introduce Dr. Esther Kim. She's the Executive Director of Digital Health Innovation at Mass General Brigham, formerly known as Partners Healthcare. She leads a new team of accelerating innovative healthcare technology pilots across the healthcare system. She's been previously the program director for one of the largest Medicaid ACOs and the nation's largest Medicare ACOs at Partners Healthcare. And she's also worked at Athena Health and led a clinical team there for hospital EMR implementations, and has been a subject matter expert in nutrition and in patient engagement for population health clients. As the Director of Wellness and Disease Management at Social Medical Center, she led a team of physicians, endocrinologists, and other hospital personnel to engage patients and help manage their chronic diseases. She also led the employment wellness programs with Virgin Pulse and received her doctorate in nutritional epidemiology at the Harvard School of Public Health. Really a very, very impressive person. Also, please allow me to introduce you to Sarah Lindenauer, who's a director in the Innovation and Digital Health Program, IDHA, at Boston Children's Hospital. The IDHA's mission is to extend Boston Children's pediatric leadership beyond the hospital walls using a transformative digital health technology strategy. She oversees the Accelerator program in its portfolio in her role with IDHA, and she's responsible for things like sourcing, vetting, and executing on key strategic partnerships. Prior to joining Boston Children's, she worked at Inventive Health, Synesis Health, consulting with biopharma companies and med device companies on digital health strategies. And before that, she worked in digital health startups. She got her master's from University of Michigan in Ann Arbor. These are two of the leading minds, I think, in the Boston area to be able to talk about hospital-led innovation. So without further ado, I'd like to hand it over first to Dr. Kim, really to first introduce a little bit about your background beyond what I introduced, but also maybe we can kick it off with the first question around understanding the rules of engagement, the expectations maybe around when companies do approach the hospital and they want to be able to work. What are the expectations around what an engagement might look like as far as the life cycle?
Great, thank you so much for the introduction, and really excited to be here. Thank you, Lori, Rupal, Carmen, and others for the invitation. I just want to mention that I was connected to this incredible Curated Collision event this afternoon with Matt Butler. He's my Senior Technical Program Manager and alumni of the program and an entrepreneur himself, and he'll also be leading one of the breakouts later. So I just want to put that plug in. Our digital health innovation team, as Robert mentioned, is a relatively new team. We're about a year old within the Mass General Brigham system. As many of you are aware, we are a very large complex system made up of two anchor academic medical centers with Brigham Health and Mass General Hospital. However, in addition to that, we have many community hospitals, many specialty hospitals, freestanding physician clinics that really make up our enterprise across the system. Within the academic medical centers, we have some great innovation hubs already. You may have already heard of the iHub at Brigham, CIDH, and HTL at Mass General Hospital. And our role is to really think at the enterprise level and to think about what might be some of the strategies and gaps that exist that really need to bubble up beyond the institution level across our whole system. One of our strategies this year is really thinking about systemness and thinking about some of the issues around health equity, disease and wellness, clinician workflow, patient experience being some of the major areas, including value-based care and population health as some of the overarching themes. So some of those are the areas that we're focused in. So to Robert's question, we've gotten a lot of great pitches, a lot of great vendors, a lot of great people, joining sort of LinkedIn chats and engaging with me and my team. We're a small team of 5 people at this point to really propose some of their incredible ideas. And in terms of the rules of engagement, where we started off, one thing I just wanted to highlight, and certainly, excited to connect with you offline, is a site called startups.partners.org, where any startup can submit their information and pitch their idea. That's one step, I think, to really engaging with us. And I'd love to discuss further, but to initially think about when you do make the pitch, know our system, know where the gaps may be, know what are some of the critical areas that you have worked with. And again, as a large system, we also value your opportunities where you might have worked in a smaller system, even in a small clinic, to say, hey, the pipes work, the waters can flow. Let's we can turn on the hot water and the cold water, just in layman's terms. So I'll leave it at that for now.
So make sure you do your homework is the message
Yes.
when it comes to engaging with hospital groups.
Yes.
Wonderful. Sarah, anything, it would be nice to hear a little bit more about your role, maybe some about how the process is concerned with regards to when outside companies might engage with you and setting expectations around that. Could you comment on that a bit?
Yeah, so we have a team of about 80 now within the Innovation and Digital Health Accelerator. So quite a large team responsible for R&D efforts. We have an Accelerator specific program that both incubates technologies from within and spins out into companies or license out that technology to other tech companies, as well as partners with startups through that accelerator process. And then we have a group focused much more on sort of implementing and operationalizing and scaling digital health technologies within the hospital. So altogether, we're a team of about 80. I think we have a similar sort of funnel and review process for reviewing startups. I think the easiest entry point is also on our website, accelerator.childrenshospital.org, where you can sort of apply to work with us. I would say we take sort of a bottom up and top down approach in terms of our focus areas and priorities. So we're sort of curating pain points from providers within the institution, from patients and families on, our various family advisory councils, and also top down from a strategic focus area perspective, and thematically sort of both sourcing in a more proactive fashion startups in those areas, as well as prioritizing those startups for partnership if they meet some of those current needs that have been either voiced from the top or the bottom. So right now, focused very heavily on sort of expanding virtual care to include now remote patient monitoring, care in hospital at home, social determinants of health, also looking heavily at equitable access where there's some significant overlap, AI and automation, which is of course a topic for today, and then also behavioral health, which has only become, I think, increasing priority over COVID. So those are some of our focus areas right now. Definitely agree, doing your homework is very helpful in terms of engaging with us. Sometimes we hear, we can integrate and be stood up in the hospital within a week. We all know that's not possible. The security review process in and of itself will take months. And so being realistic, being patient, understanding that our role really in IDEHA is to shepherd the startup through that process and to serve as your advocate and to serve as sort of a matchmaker in finding champions and end users that are really excited, because that's key to success. And so we help to try and make the process as simple as possible, but it is a tough place to navigate. And so understanding that and the various components of what it takes to sort of launch within a hospital is important for sure. I'll leave it there for now.
Thank you, Sarah. No, absolutely. At Boston Children's, being the #1 hospital in the world, a children's hospital in the world, you obviously get a lot of inbound inquiries and folks who want to partner with you. I've had some experience as well partnering. Could you just elaborate a little bit on the different ways that a third-party company might come in off the street, so to speak, and work with Boston Children's?
Certainly, yeah. So we partner at all stages. I would say at the earlier stages, we're much more likely to do a sort of co-development type partnership where perhaps a company is expanding into pediatrics or a particular disease state in which we, have experience and can sort of help them expand their product in a co-development capacity. Sometimes it's more of an advisory consulting style relationship, but with early stage startups, we try to sort of move beyond just the pilot. the failures we've found in engaging with startups are short-term free pilots. There aren't enough of an incentive to really make a long-term meaningful relationship work when A, it's free, and B, it's short-term, and the implementation and really operationalizing these things and to do so well and to see outcomes take some time. So we really try and form meaningful partnerships with earlier stage companies beyond just the pilot. We have made a few capital investments out of our innovation group as well. And then later stage companies, we will source, strong vendors as well, where there's a true hospital need and demand, and again, are very sort of KPI focused and being able to demonstrate outcomes. And in order to engage in a vendor capacity, certainly need to see some ROI opportunity there, but we will also engage in just a simple vendor relationship where that makes the most sense for the company as well.
And certainly passing through the security assessment is often a thing that startups don't anticipate. So having the runway to be able to last a year or more to go through that process is often something that startups don't think about, just the waiting process and going through the protocols. So I certainly have that experience firsthand. Esther, I guess the same question. What are some of the ways that outside companies can partner with Mass General Brigham?
I think it's very similar to Sarah in that we have many venues. So some of the smaller startups may actually start in one of our institutions, such as Brigham or Mass General, to engage. They may also bubble up to us. We've certainly had vendors that we work directly with that haven't been part of the institution thus far, which, as Sarah mentioned, can be a slightly bumpier road as they navigate all of the different paperwork, security reviews, and others that may need to process. I think one of the things that I'll add is the importance for startups to also think about what are some of the minimal viable integration and minimal viable product to again, knowing the hospital and knowing the system to be able to present. I think one of the things that we've also found that, people are really excited once they are able to talk to us, they want to do everything plus the sink and the dishwasher and so on. And sometimes that's not the best way to also proceed, especially if that requires a lengthier, InfoSec review. Let's get you through that door. Let's, as Sarah mentioned, start that meaningful partnership. See how it's like to work with each other. Also, sometimes, vendor personalities with a hospital personality unfortunately doesn't match. Other times it's a great fit and we know it's going to be a really wonderful partnership. So thinking about being flexible also as to how you engage with us as a system, I think is really important.
Right. You have to date before you get married kind of premise, right?
Yep, definitely.
In terms of the criteria, of course, companies are coming to you from all different stages. They have different technologies, different levels of, how far they've already scaled. But could you comment a little bit? I know, for example, it's often quite important to find a clinical champion internally. So maybe that's one of the best practices that we should touch upon right now.
Yes, I think it is important to think both about a clinical and an operational championship. At least within our system, we typically work in a dyad model. So you want to ensure to, for example, if you're thinking about pulmonology, who are some of the pulmonary champions at Mass General, and trying to engage with them, and also really thinking about what might be the potential workflows. One of the challenges with technology, it can be really great. It can fill a really important need, but if there's a significant shift in a workflow of a clinical team or an operational team, may not get the buy-in that it needs. So that's where I say really try to do your homework, be as engaged as possible. And Boston is a very small community in particular that I'm sure, with a few degrees of separation, you probably know someone that knows someone that can get your foot in the door.
That's absolutely right. Sarah, same question. What are some of maybe the criteria that you find to be those companies that approach you that have done their homework? What are some of those attributes that you find to be attractive about them?
Yeah, understanding sort of the broader landscape and market moves and where they fit in and how they're differentiated, and being able to very clearly state what the value proposition and unique value proposition ideally of their solution is, specifically for the hospital and for the end users of whatever the solution is, wherever they can back that up with case studies and demonstrated ROI. That's all obviously better. I think we also really just, speaking of sort of like dating before marriage, we really value sort of not just the personality fit, but the, you know, experience of the team and belief in the team. Some of these companies are so early stage that maybe their product, you know, hasn't yet seen, you know, $1 million results at other institutions. But if we believe in the team and we believe in the value proposition, there are many cases in which we'll work with them anyway. So that's definitely big. And then definitely champion departments and users. We've adopted a process in our review of startups and vetting process where we bring those clinical champions to the table for sort of to hear the pitch firsthand after we've done some vetting ourselves to ensure we're not sort of wasting clinician time, but we bring them in early in the process because we may think that the startup, and in many cases the startup is successful, but if it's not a need or a fit from a workflow perspective, we'd rather know sooner rather than later and get them engaged so that they feel like they have some skin in the game as well, and that we're not just sort of throwing it at them at the last second. So definitely engaging them early has been key for success.
Right. No, that's absolutely true. And I want to make sure I leave some time to take some questions from the audience. So here are a few that are queuing up now. How, if at all, have your priorities changed as a result of the past year with the pandemic, social equity, these kinds of issues? Maybe we'll start, Sarah, with you with that.
Yeah. They've changed in terms of the speed at which we've seen technologies be adopted. So we were doing, 20 or so virtual visits a day pre-pandemic, and now 50% of our ambulatory visits are still to this day conducted virtually and plan to do so moving forward, even though it's safe to return in person, or even when it is safe to return in person. And so we've seen just a massive adoption and sort of a receptivity switch on behalf of mostly providers. And so it's just accelerated the pace with which we've been able to explore things such as remote patient monitoring and sort of hospital at home, and things that we had on our roadmap for maybe 5-10 years out that we're now actively piloting and working on. So it's really been an acceleration there. And then I think on the social equity and social determinants has been a priority for us for quite some time. I think we often think about digital solutions as bridging access gaps. And I think we had to take a look in the mirror and actually look at the data to understand that in some cases it's actually, technology has the potential to even widen those access gaps where Wi-Fi challenges and other issues come into play. And so we've really taken a hard look at the data and have a new sort of framework for evaluating our technologies that we're deploying with patient populations to be able to ensure equitable access, and where necessary, deploying Wi-Fi enabled devices, MiFis, et cetera, alongside, for example, remote patient monitoring devices, so that we're able to ensure more equitable access. So that's definitely been another priority for sure. But I would say overall, the biggest takeaway is just there's a lot more willingness to engage and a lot more openness from clinical departments to try things and to learn and not to have to get it perfect the first time, which has been really refreshing, because as we know, innovation is usually not perfect the very first time.
Right, innovation happens because it needs to, not because it wants to.
Yeah.
Right, I think that's an important takeaway from there. Esther, how about from your group in terms of the pandemic and how things have changed?
Yeah, very similar to Sarah's group, and I'm sure it's a theme for most of the hospital systems that we really did accelerate a lot of our work. Thinking about when COVID first hit and we needed to get education and information out to our patient, within 24 hours, we had a chatbot that was built within our website. That would have just not been possible prior to. And one of the, I think, important concepts that Sarah mentioned is really about that launch and learn. Innovation is continuing to iterate. You don't have a fully baked product from the beginning. You do need to continue to iterate. You do need to continue to work. That happened to a lot of our work, especially we're building out new products and new functionality to support whether it's COVID attestation for our employees and patients, COVID vaccinations. The state kept changing their minds on some of the rules. And so we had to continue to be flexible. So as a large system, we also learned how to become more agile and to really become more flexible to the needs of what was happening around us. And in terms of equity, it really was also thinking about where does technology where can it not fill the gap, and how can we help those that, we won't be able to fill the gap? So one example is we had built up a survey for employee post-vaccination symptom checker, but we know a lot of our employees, especially in environmental services, food services, transportation, and others, may not be able to use the app that we built out. So we provided additional language support. We provided additional support where Navigator would be able to call and engage with them. That was a really good supplement for the technology that we had. We've also been better leveraging AI and natural language processing to be able to call patients and try to book patients solely over the phone, and to also have it available in multiple languages, ensuring that we're trying to reach every patient possible using technology and also not using technology as well.
Right. No, that's a really, and the fact is technology should be adding value to society and acting as an aggregator and making, the patient experience a better experience. And so when you bring in things like, logistical constraints around visiting your doctor during, the pandemic, innovation happens because it wants to, not because it needs to. But once you go through that initial learning pains, you start to realize, hey, actually, we're solving a kind of different issue, issues of access and issues of the cost for a lot of families to come into the hospital for, whether it's, coming into the expensive Boston hospitals, it can be an all-day experience, right? So now I think we're learning that it doesn't need to be that way. And so I think they talk about silver linings. I think that's one of them. So let me take another question here. Of course, being a startup person, I know being resourceful is the name of the game, right? And so this person asks, what is the average budget needed for an early stage company to run an initial pilot study within your institutions? Are there any resources for funding that your divisions can point companies towards? So either of you can chime in on that. I know, of course, every company wants to know, how do we get this funded? This must be so important for the hospital. Isn't there a venture fund for that? Of course, but we know that, ideas come from all over the place, and it's more about, showing the scale and showing the product market fit. So it all, I think, goes back to, and I'll just, maybe as a preamble to the question, it all comes back to, have you done your homework? How realistic is your proposition? How much do you have a clinical champion from within? Is this really a value driver within the organization? And I would guess, Esther, I would guess that from your side, maybe once those boxes are checked, perhaps some resources start to appear from within different offices and different departments within the hospital, right?
I think the average budget, it's really hard to say because it depends how many people you employ and what additional development is needed on the product to get it ready for pilot at the institution. So I think it's hard to say. I would not offer free pilots where you think there is value to be had for the institution. It just really sets the startup up for failure to pilot for free. I strongly believe this. If there's no, money on the line, there's less incentive for the organization, the department to really try and adopt it. And there's always going to be some friction at the beginning of adopting a new tool or adapting a workflow. And if there's no money on the line, it's a lot easier to say, I'm not going to really take this seriously or try than if there is money on the line. So I would charge for pilots. I think in terms of funding, there are plenty of sort of seed and angel and family foundation and small business loans types of funding that, we have a bunch of relationships with a bunch of different investor groups across a variety of, and also grant funding, of course, although usually a slower cycle than startups want to deal with. So happy to, make recommendations or introductions as appropriate in terms of funding, but I wouldn't offer, per the first question, I wouldn't run a pilot study for free, because we also understand that a lot of resources are going to work to get that pilot study underway.
Yep. And of course, this event is about AI. So specific to AI, let's dig into that a little bit. In which area are you actually using AI, as a multiplier? Of course, this is a broad question. And what are some of the pitfalls of AI, and how are you mitigating and kind of monitoring? After all, it is artificial intelligence.
So one area I previously mentioned is really thinking about how we are engaging with our patients to schedule their vaccine appointments. So using AI and natural language processing there. I think the general pitfall, and we have other use cases working with virtual scribes and AI. I think the general pitfall right now is that AI still in some ways is very immature and needs a lot of data to learn to get better. And a lot of times we don't have that time for AI to learn. And when we sort of peel back the onion, there's a lot of instances where we found it's actually mostly human power that's still driving the work, and AI is just a small component. So I do think it's an important part of the work that we do, and will continue to get better. But at least from our experience thus far, it's still in the less mature stage. Is definitely a great buzzword to throw around there, but I think it's also important as a startup to also be transparent about where you are in the process. Another important thing to consider in terms of a collaboration or a co-development opportunity, which exists, I think, in most institutions, is also for the startups to be very upfront about what data you might need. We have very strict sort of data sharing requirements, which sometimes unfortunately doesn't work, sometimes it does. And especially for AI to learn, it needs a tremendous amount of the data that we may or may not be willing to share.
Right, it's still a function. AI is still a function based on human assumptions and presumptions. And I think it really matters, what is it that you're hoping to influence? What is the decision that you're influencing? What is that use case? Because I like to say, more data, more problems, right? So if you have more information out there, it doesn't mean that you're going to make better decisions. It sometimes can mean analysis paralysis, and which direction do we go in? And so you don't end up being that kind of lean startup that we expect. So no, I think in terms of the example companies that I see coming here, they oftentimes don't necessarily understand the context within the hospital. They have a much more broad view of how it could work, but they don't actually understand maybe how it's going to be reimbursed, who's going to pay for it, who are the stakeholders internally who would actually be the the folks who would actually is there a code associated with it? These are all these considerations that just because you have an innovation doesn't mean you're necessarily on the path to commercialization yet, right? So let's see, some other questions coming from the crowd. What is the best way for a startup to gain visibility into the specific systems, ecosystem, and relevant technology stacks to help define and a realizable innovation concepts that are most likely to gain traction? So basically, what are some of the ways that a startup can actually do that, to get out there? And I assume a lot of folks aren't necessarily business development folks, but maybe they come from a technical standpoint. People come from a diverse background. So oftentimes it's difficult for people to get out there and kind of socialize their innovation.
One thing we put together was originally targeted at innovators within the hospital, but we've since expanded it, was sort of an innovators roadmap. We find that clinicians often have the best ideas and also, an understanding of how it will impact workflow, et cetera. But it's only a subset of those also have tech or business or other types of background that's necessary to start a company. So we put together an innovators roadmap that guides through basically from idea stage through to, actually having a go-to-market strategy and a product defined, what those important steps and exercises are to get there. So I think that's a helpful resource. It's downloadable on our website. It's just called the Innovators Roadmap. I think there's also just a number of resources out there to get a sense of the competitive landscape and like where there are gaps in the market. Rock Health is specific in the digital health space, CB Insights, a bunch of others that we have relationships with. And then I think, just have conversations. We have a network of investors and entrepreneurs and obviously folks within the hospital that were constantly saying, we're looking at this space, or we're looking at this company, or, do you know of any innovations? And even when you've done all your digging online and think there's nothing, there's 8 companies that are already looking at it. So having conversations and getting feedback and adapting over time, and being open to adapting over time rather than setting sort of a vision and sticking with it. The willingness to morph to meet market needs, I think, is an important piece as well.
Very, very good. No, it's very good response. Thank you. So I think that just about does it for our time. Again, I appreciate your time today, Sarah and Esther. This has been really a pleasure and an honor to return to my alma mater and to be able to serve in this capacity. It's really a pleasure. Thank you so much.
Thanks for having us.
Thanks, Robert. Thanks, Esther. And thanks, Sarah. That was an awesome session. So many different things to think about, from, what should startups do to how's the AI, is it ready yet, and so on and so forth. So I'm sure these themes are going to come across in some of the other breakout sessions that we have too. So we have just a transition point now from this panel discussion to the breakout sessions. And if you haven't been to a Curated Collisions before, the breakout sessions are the time for you to participate, for everyone to participate. So we're hoping everyone will turn their cameras on, turn their phone, put their phones away. It's sort of like your intellectual spa, the time where you get to not think about your real job and actually get to interact with others. The stuff that we've forgotten how to do now that we're just in these little boxes, and hopefully we can remember how to do that again. We have 4 concurrent breakout sessions. One is on IP issues in AI and digital health. The other is on digital health for physical rehabilitation, and another on digital health accelerators, which we'll probably continue on some of this conversation we've been having here. And the last is in digital delivery of care and nurse education and innovation in digital health and wellness. So you will see, many of you have given us some of your choices, and you'll have an opportunity to actually select which of those breakout rooms that you want to go into. We'll start those breakout rooms at 2:50, but you just have some time between now and then to transition into that and do your bio break or whatever else you need to. But we will start those breakout sessions with the team leads at 2:50. Thank you, and enjoy the conversations.
So welcome back, everyone. I hope that you had some fruitful discussions. Looking forward to hearing about them in our breakout session. Our share out session at the end. We have 3 things coming up right now. One is, as part of our Curated Collisions event, we'd love to showcase and celebrate entrepreneurs. So as part of this, continuing with our tradition of our first Curated Collisions, we've invited a few entrepreneurs to provide recorded videos of what they're doing with their startups. So before our next panel, we're going to showcase 2 of them, and then after our next panel, we will showcase the other 2. So the first 2 that we're going to show are, one is from founder Victor Kutin. He's a Northeastern alum, and he's the founder of Air Fresco, the first company to offer a 100% digital employee benefit program that also includes access to the only scientifically proven mindfulness meditation app created by and for Hispanics. So that will be one of our videos I'll be showing very shortly. And then the other one is from Northeastern alum, Cassie Choi, who's the co-founder of Pair Team. They provide both a remote team and AI that automates workflows, provides infrastructures, and improves medical practices, efficiencies, and billing, as you'd expect, but all driving toward value-based quality patient care. So you'll see more in their videos. So I'm going to share my screen and show those videos right now, and then we'll move into our next panel. Okay. I don't think this is working the way I had hoped. We may have to do all four after this because
That's fine. Why don't we do that?
okay.
Why
Let's
don't we
do that.
group them together and have the four together? So why don't we move to the next panel, which is industry-led digital health and wellness innovation. And this time we have another moderator, Dr. Maria Van Pelt from Northeastern University. She is the Dean of the School of Nursing at Northeastern University and also a clinical professor in Bouvet College of Health Sciences. She's an internationally renowned scholar and leader in patient safety. She's a fellow of the American Academy of Nursing and has been at the forefront of advocacy, education, research, and policy development related to clinical peer support and wellness. Dr. Van Pelt is also going to be speaking with Dr. Claire Purvis from Headspace and Dr. Jacqueline Shibarty from Google Health. Hopefully I didn't mix that up too much, Jacqueline. All right, handing it over to you, Maria.
Thank you, and good afternoon, everyone. It's so exciting to be with you here this afternoon. I am so excited to introduce to you our two panelists. I'll first start off with Dr. Claire Purvis. She is a licensed clinical psychologist and senior director of behavioral sciences of Headspace. Her work is focused on using technology to support people in living full and vital lives. Dr. Purvis is an expert in the design and evaluation of digital mental health interventions. She completed a postdoctoral fellowship in value-based healthcare innovation in the Clinical Excellence Research Center at Stanford University, where she now serves as an affiliate scholar focused on the use of technology to make great healthcare more affordable. She received her BA in psychology and international studies from the University of Wisconsin-Madison and her PsyD in clinical psychology from the PGSP Stanford Consortium. Welcome, Dr. Purvis. Dr. Jacqueline Shibarty is the clinical lead and health economist at Google Health. She was previously the chief medical officer at digital health startup AliveCore. Dr. Shibarty is adjunct faculty at Stanford School of Medicine and practices general cardiology at a federally qualified health center. She received her BA from Columbia and her MD and MS in health services research from Stanford. She is active with the American College of Cardiology, including the Board of Trustees, Clinical Wellbeing Task Force, and the Innovation Section Leadership Council. Welcome, Dr. Shibarty.
Thanks, Maria.
So great to have you both here. So I say, what an exciting time to really have you as panelists. And when I think about your experiences related to AI and the digital health space, can you hear me okay? Yeah? Okay, I thought I saw somebody put their hand up to their ear. So when I think about all of your experience, your professional work that you've done as it relates to AI and digital health, I'm wondering if each of you could share a little bit about some of the initiatives that are underway that you're excited about and share it with the audience.
Certainly. I'm sure you have more going on, Jacqueline, if you want to start ththings off.
No, you start. You go first, Claire.
Sure. Well, when it comes to AI, so for those who might not be as familiar, as Maria mentioned, I'm at Headspace. We're a global leader in mindfulness meditation, delivered via mobile app. So Headspace has been in operation first as an events company and now as a mobile apps company for the last 10 years. Sorry, I'm getting a little bit of an echo. Is that coming through for anyone else? We okay? Okay.
It's okay.
Great. So over that time, Headspace really has amassed this very large library, really, of meditation and mindfulness exercises or practices that are on the app. And a challenge that we've run into is, how does one meaningfully navigate through this amount of content in a way that will serve their health and wellness related goals? And so the way that we're thinking of, we're very nascent in our use of AI at the company, but in our main application of that and the initiatives we have underway are really about personalization in the delivery of health and wellness content in the service of individual goals. And so certainly can speak more about kind of how that looks or what kind of things we're exploring at Headspace, but largely that is, the way we think about that with our current offering. And as we think about, expanding how we serve our members in a more clinical health direction, that's one of the areas in which we're hoping to grow in terms of serving more clinical mental health needs. And that starts to look then as AI helping to provide care navigation through what you could think of as care pathways, but again, delivered primarily in the form of digital therapeutic content that's served in the platform. So that again is quite nascent. That's in an R&D phase, but AI in terms of navigation through our existing wellness content is something we're already testing in market.
Thanks, Claire. And I just have one follow-up question related to that in terms of the personalization that you have done. I'm curious to learn a little bit more about some of the opportunities that you saw with the pandemic and some of the personalization that perhaps your company did as it relates to the needs of the world.
Yeah, I think, this past year certainly, I think has really heightened awareness about the importance of expanding access to tools that can help us manage our health and well-being. And that's something that certainly Headspace as a digital well-being company is very well poised to do. Something that we certainly recognized, we had recognized it before the pandemic, but it became really critical this past year, is that our existing content and platform was not representative enough and was not inclusive enough of, a broad enough population. We had there's many layers in which we can talk about that, but we have already in the app today, what you can see is the result of several initiatives that were underway in the last year around bringing in new teachers into our platforms, teachers that were representative of groups that hadn't been represented in our platform before, specifically BIPOC teachers, and looking at how our content can evolve to also more effectively address experiences of trauma, experiences of anxiety, and really thinking about, how do we evolve the way that our product and content is constructed and the voices and experiences represented there to reach a broader audience, and one that is, in this past year, certainly there was heightened demand for our product, and we knew that we really needed to improve it to make it relevant and accessible to all of those who are kind of reaching out to use the product.
Great, thank you. And Dr. Shribati, I'll have you speak on something that you're excited about as it relates to some of the initiatives that are underway.
Mm-hmm. Well, I think Claire alluded to the fact that people often associate Google with AI, so I don't need to kind of justify all of the engineering resources that have gone into it, but how it applies to health, I think, is less well understood. So, thinking back to the mission of the company, which is to organize the world's information and make it universally accessible and useful. When you put on like the health lens, you begin to see all of the possibilities for helping people understand their health information, giving context, and providing access to care or comprehension of that information where there was none. So we have a pretty robust research group that is routinely publishing papers, peer-reviewed manuscripts in Nature and Lancet on the ability to use our image recognition technology to detect cancer or abnormal masses in a radiology image. So for example, with prostate cancer, with biopsies for colonoscopy, for lung cancer with low dose CT, with breast cancer from mammography, with biopsy data for melanoma. So this constant kind of research group that's working on it. And then there's a group of folks who are thinking about which of those research ideas should be made into products. And that's a complex decision. Some of the ones that have come out to market include a screening for diabetic retinopathy, where they take retinal images and they can, this AI tells you kind of the level of retinopathy that you might have. We have active work in Thailand and India on that regard. We just announced earlier this week that we have a consumer technology where consumers can research their skin condition by taking a picture. As you can imagine, I've done this myself with my own children. I go to skin rash, I put Google Photos, I see a bunch of rashes and I'm overwhelmed and can't figure out what to do next. So we're trying to make sense of that human dilemma, which is quite universal, goes from rashes to melanoma, and provide folks with somewhat of like a differential list of possible conditions it could be when you take a picture. So we just got CE marking class 1 in Europe for that earlier this month. So that's a research idea that's now been conceptualized into a product. So that's image recognition. Then from kind of the more traditional search expertise, we have some work with Ascension Healthcare System in Tennessee and in Jacksonville, where we're able to take the live electronic health records feeds and standardize and harmonize that data and then search it live. And the search capacities are pretty powerful for clinicians, ranging from allied health professionals to critical care physicians and nurses, so they can look up information in ways that we believe, because it was helped conceived by clinicians, in ways that are accessible and logical. And you can search scanned documents. You can look for predicted problem lists. If you search for clot, you'll see any note related to vitamin K deficiency. They're not exact term searches, so there's lots of work on that end. So I'll stop there and take any questions or.
That's incredible. Thank you so much for sharing. And I think what speaks to me is there's so many needs that are being met from the technology that you're using. It's absolutely incredible. And it also brings me to the other side of the spectrum in terms of you being a clinician and having the background and the requisite skill set and knowledge to know that there are unmet needs. And so, the incredible work that you are doing, how are you, embracing and thinking about the unmet needs of whether it be health disparities or, it could go, there's a spectrum of areas, right? What technology are you using to identify those?
Yeah, I think some of the questions that come around is like, how do you insert a clinician or someone with some type of clinical expertise into health tech? And I'm sure Headspace has been working on this, and we've been working on it for quite some time. There's all different ways of working. I think we can draw a lot of parallels to what happens when you do a quality improvement or healthcare delivery, in an academic medical center or your local community center. You have to somehow inject a clinician into IT support, or with local engineers or non-clinical folks. And it's definitely a work in progress. So we have some clinicians who are fully embedded in product decisions and scoping, right? And when you're asking questions about how do you decide how much to tailor a program, or are we targeting vulnerable populations or folks who might not have otherwise used Google technology, in those situations where clinicians are embedded, where we have product inclusion officers embedded in the product, we can make more of an impact. So for example, we have some pilots going on with a user feedback program that we recently announced, I think a month or two ago, where we deliberately chose geographies across the country, looking for expertise and experience from safety net clinicians. So we're working hand in hand with safety net hospitals in the Bay Area, in Chicago and other geographies, so that we get their early feedback. But that decision wouldn't have been made if there weren't clinicians and product inclusion experts at the table in the beginning. There's other projects that are kind of like, they're out there in the market, and we kind of come in sometimes more as consultants, or trying to figure out ways to steer the Titanic, so to speak, in different ways that are more responsive to user needs. But it's very difficult. It's hard to change ways, and we're slowly but surely, I think, developing the rapport and trust with the engineers and product teams at Google to make a real impact.
Thank you. And I'll just read one comment from the chat, and then I'm going to go back to a question for Claire. But one of our colleagues in the audience says, luckily, it's easier to learn technology as a nurse or a clinician than it is as a developer to know and understand the clinical workflow of the healthcare culture. And that is so true. Thank you for your contribution.
You'd be surprised, though, how many ex-MDs and ex-RNs you can find at Google. So I'm always surprised, like, oh, they're software engineer by day, and then you find out that they were practicing physician in India or in Europe, or they're still actively practicing. So there's a lot of that kind of, I would say, cross-contamination, so to speak. And it's really humbling to kind of work with some folks who are top of their license AI engineers and ex-physicians
Yeah, fabulous. So Claire, here's the question for you as it relates to Headspace. And I had brought up some of the opportunities for your company and where they went amid the pandemic. And as we are all well aware that there's a lot of grief that we are experiencing globally. And one of our participants has asked, how has Headspace been thinking about grief, especially this past year? And also someone who thinks about voice. What, if anything, are you doing about different voice interfaces to make it a more diverse interface with your participants? Thank you.
Yeah, thank you for the question. With regard to grief, I can start there. Headspace has actually had, so the way that the content is organized inside the app, for those who haven't looked at it before, there's a kind of general introduction to meditation. That's a course that, that members can work their way through practicing, ideally practicing one session each day. And then after the introductory, which we call basics course, there's all kinds of other topic areas where we've organized meditations around a particular topic. And for a long time, there's been a 30-day course on grief. That is currently, I'd say, the most specific content that we have that is really directly addressing the experiences around grief, naming that, working that into kind of the teachings throughout the course. But as we think about, the long tail of COVID-19 and really not only grief, but trauma and other mental health related experiences that people have going into this next year, that's been a huge area of focus for us. I'd say we're thinking about it a bit more broadly, which is to say, my team and specifically is tasked with really designing a vision for what does it look like for Headspace to evolve from kind of general wellness solutions into a more clinically oriented mental health platform. And so certainly that, would kind of expand beyond a specific focus on grief, but would think about, given, and this is motivated really by the events of the last year in some ways, that we know that this is a really important need that people have, and that our current product does need to kind of evolve and strengthen its offering in different ways to be able to adequately address that. And so I'd say we're thinking about that kind of more holistically, or maybe from a more zoomed out perspective. And I would say grief will certainly need to be a part of that. And probably on the clinical side, we're thinking more things like more of the clinical presentation, whereas as grief certainly would be not something that necessarily requires a clinical intervention, but would benefit from support for many people. As far as voice, that's a great question, and one that we talk about a lot. So there's a couple ways, and RuPaul, you can also let me know if you meant something specific about this, but with voice, so as I mentioned earlier, we're bringing new teachers onto the platform, and so that obviously they have their own voice and their own style of teaching. And so we brought on I believe there's 2 of our teachers are actually in the app, and we have a third who's recording with us now. These are teachers from BIPOC communities, teachers who bring different styles of meditation and mindfulness into the platform. But another thing that's really important with accessibility and voice is around, how do we make this accessible for hearing impaired and deaf members? And so we are actively underway with captioning all of our meditations so that is accessible to hearing impaired listener members. That has been, I think, Jacqueline raised a few comments like this of, as a clinician working in tech and starting to kind of more deeply understand how this work comes together and how we bring these things to life. I mean, the level of cross-functional support, time, effort, resources needed to do things like record all of our courses with a new teacher, to caption all of our existing meditations. Like that's been rather resource intensive, and it's been really, from my perspective, just really wonderful to see our company decide to prioritize using our resources in that way to expand accessibility. But certainly beyond that, there's much more that is on the roadmap that we need to do and needs to be, kind of planned and resourced out.
Thank you. And I just want to acknowledge one of the first comments, because I think you really touched upon it earlier when you were talking about the opportunity for Headspace to go into that area of grief, and acknowledging that there's the whole therapeutic space. And so that expansion, and kind of how you just discussed with us, that you zoomed out and looked at the bigger picture, but that is a whole, the pandemic has opened up that opportunity for Headspace and Google and tech companies to really make a huge difference in people's lives. So I just want to acknowledge that comment from Danny and thank you for that. I have a question for Jacqueline, and this is in particular question related to health. And the question is there a particular area of health that Google can make a difference in that no other entity can because of its advanced AI?
Yeah, I like to think about that question without the advanced AI part, because I do think that is important. But when I think about Google, now that I've been working on some of the projects, what I've come to see is that we are basically a place where a lot of people come to for information about their health in particular, such that 1 in 15 searches are health related, like 7%. And so in some ways, and I think our Chief Health Officer, Dr. Karen DeSalvo, has been talking with this at large, is Google is very much a public health company, whether it wants to be there or not, because people are coming for health information. And that was all more prescient during the last year and a half with the COVID pandemic. So whereas AI might be underwriting a lot of the search, I would say the platform, the access that we have across the board for finding information about your health is really, we have an obligation to make it better and make it more useful and understandable for people. So a lot of the work that we've done in the last year, let's say for mental health, we've made more self-assessments available when people type in symptoms in the search bar. And we're connecting people to authoritative information from National Alliance on Mental Illness, from the US Office for Women's Health. In Australia, we're working with the Black Dog Institute. So the platform itself and connecting people, I think, is really where our greatest opportunity is for the world. That isn't necessarily AI, the fact that we're able to connect people with trusted resources and provide them links to support lines and all that, but I think it's where our greatest value will come from in terms of health impact.
Thank you. And one of the questions I have is related to that, and it would be, what is your opinion on the patient of the future being able to self-diagnose or self-medicate without a practitioner's intervention using digital health and therapeutic products? Yeah. Do you have an opinion on that?
I have to check myself, because like the doctor had me like, I literally feel nauseous when I think about that. Yes. I remember having like the person who was really underwriting the last company I was at has this vision of individuals doing their own cardiac echocardiograms, right? They take the ultrasound and they're like putting it on their chest and they're figuring out if they have aortic stenosis, and then they're doing their lab tests. And I was hearing this and I was like, this is not happening. Like, how could this possibly happen? I'm going to be inundated with poor quality data. People are going to be confused. There's going to be mass hysteria, untapped costs. But as I haven't been doing this for that long, but in the last couple of years, I think I've come to see that there are actually now products on the market that are enabling laypersons to do accurate echocardiograms. And wouldn't that be great, right? If people are able to do an image of their heart at home, and they would get, there would be some checks and balances in play. And of course, we have mechanisms to ensure, hopefully, that reimbursement is for medically necessary activities and not for unnecessary ones. So there is that component, but there is probably some happy balance where patients are empowered, they're doing some of the work themselves, and clinicians and other care staff are able to receive that data in like an ingestible way, not literally like reams of paper of data points like you get like on a pacemaker report. Like if that's the future, I'd say no way, but I think there's probably better ways of ingesting and presenting the data to care teams and making and basically uplifting everyone. So there is a reality that I'm optimistic about, but then there's parts of me that are a little bit terrified. So I think having kind of that both mindedness is good. It kind of keeps me on my toes and keeps me honest when I'm both practicing medicine and working with engineers. And we have a ways to go, but I do think there is a future where a lot of that stuff can happen at home. Not all of it, of course. No, I mean, who knows? Maybe people will be operating on themselves in 100 years. I don't know, but like, I couldn't imagine people doing their own echocardiograms 10 years ago, and I think that will happen at some point.
And I'm going to go back to just one question. Time is flying. So thank you everyone for all your great questions, and apologies if I can't get to them all, but this one intrigues me, and it's related to processes that both of you have described. And there's a question that is being asked about addressing biases incorporated into algorithms. And I'm curious if this is an area that either one of you have really given some thought, and they're asking to describe approaches that you've taken to ensure integrity, quality, validity of information that's being accumulated from the user interface as a source.
Yeah, well, we're quite nascent, so I can comment a little bit about, I'd say for us, it's more ideological at this point, but we have the way that we're trying to operationalize making sure that we build any AI systems from the very beginning in an unbiased way. So far has really leveraged having the right people involved in that process from the beginning. And so, you know, again, we're still building our capability, or still kind of designing how we're going to build our capability. But what we have put together is a team that's not only including our kind of ML and AI data engineers, but also representative from my science team. We have external consultants as well. And we lean on, you know, consultants that have demonstrated backgrounds in AI ethics as part of that team, and really have created conditions wherein we're trying to build in those checks and balances internally to say, is a group of people that's building this system in and of themselves, bringing diverse backgrounds. Is that team coming from multiple perspectives, not only kind of thinking of this as an engineering problem, and then are we bringing in that external perspective to kind of help us fill in those gaps with expertise that we may not have, at least not yet internally. So I think, you know, and even in that, it was surprising to me that kind of my team was the one that stepped up to kind of pump the brakes a little bit when we first started having these conversations, to say, wait, we need a more representative team here. We need a few more voices in the room. We need to really be thoughtful in how we build this. And of course, anytime, I think in many industry environments, but tech is a good example, anytime that you're kind of pumping the brakes and saying, whoa, wait, we actually need to do ABC before we dive into this. I think it can ruffle some feathers, or, you know, you can be accused of maybe slowing down the process, but I was happy to see that, you know, ultimately we were kind of approved in taking this a slightly slower in the beginning, but ultimately, you know, more thoughtful and I think more effective approach. But certainly, again, it's early days for us. And so this will require a lot of continued monitoring and experimentation over time to ensure that we're actually, you know, putting our money where our mouth is, and building systems that are not reinforcing bias at scale.
Thank you. And I really want to ask either one of you to answer this question, because I think it's an important question to ask. And it was originally highlighted for Jacqueline, but what do either one of you think that the future opportunity is for partnering with healthcare education? This could be from pharmacy to nursing, medicine, physician assistants, and physical therapy. I mean, there's the whole healthcare profession, but what do you see as that opportunity?
I think we're wholly dependent on it. We cannot, and no one should claim to internally be able to say this information is trustworthy, authoritative, accurate, and correct. Like we must rely on outside sources for that, especially as it regards to health. Some of those decisions, for example, during COVID were made during, you can see there's like an informational hub. If you searched for COVID in the search bar, and you would see all these sources that we have decided to some extent are the trustworthy authoritative ones, whether it's, Johns Hopkins or New York Times or CDC. But I think the challenge that we have learned during the pandemic, like looking for trustworthy sources, is that even like making that decision with a capital T comes with a level of bias, because what clinicians might think of as authoritative and trustworthy, for example, the CDC, that may not be universal, right? Like there's a lot of mistrust. There's a lot of concern about who is providing information that you can believe in and trust. So that is, I think, that even trying to defer some of those decisions about correctness and information to third parties lends itself to some dilemmas and trying to figure out what is useful. And we're tasked with making the world's information accessible and useful, right, for everyone. That is almost an impossible task, because everyone's going to have different opinions about it, what is trustworthy and useful. So sometimes we get feedback from users just in comments, feedback. We get feedback through lots of user research testing. Certainly third parties doing their own analyses of our output are helpful for that. We actually have a team of in-house bioethicists who help us make decisions and help guide us towards picking sources that are trustworthy and useful and scalable. That's kind of also the elephant in the room, is that Google's also always looking for something that scales. So there's definitely a bias against smaller sources of highly trustworthy content. If it's small, sometimes those sources can be overlooked. So I would say, looking forward, it's not as easy as one might think to kind of identify like what's trustworthy, particularly in health, and it has to be multi-pronged, and it's evolving. It's definitely dynamic, and I wish it was not as problematic as it seems, but this is true for not just health information, but generally any information people are seeking these days on the internet.
Well, thank you. And the time has come. It went by so fast. I want to take the opportunity to thank you, Dr. Sherbati and Dr. Purvis, for your time, your expertise, and for spending your afternoon with us. I will turn the program back over to Laurie. I believe that there are some showcasing that we wanted to, move forward with that we didn't do in the beginning of the session. So, Laurie.
Thank you, Maria. Thank you, Jacqueline and Claire. What an interesting discussion. We really appreciate your time and insights. I look forward to looking at all of these the recordings again. Just so much that's being shared today. So thank you very much for your time today. And so the rest of the event is going to go like this. We're going to show the videos. We have 4 videos, 4 startups that we'd like to showcase. I'm going to show them right in a row. There'll be a little bit of time for a bio break, and then at 4:15 is when our final breakout session happens. So we'll be assigning people to those breakout sessions. We're really excited about the final chats, and then at about 4:45 we'll be having a 15 minutes of sharing out of the key takeaways and things that we learned in the breakout sessions and throughout the day. So I'm going to once again I had introduced 2 of the startups. One is Pear Team and one is Air Fresco. And so I'm going to start with those videos. Okay. There we go. Let's see if this works.
Calm down is a phrase that has come exactly 0 people in the history of humankind. Have you ever wondered why is it that we use such an inefficient strategy trying to get others and sometimes even ourselves to come back to a state of calm? Imagine for a moment a person in their 30s going through an international divorce with children in between. Imagine a moment that person being torn apart from their child, who now lives on the other side of the ocean. Let's think of that person now in their mid-30s, discovering for the first time, breathing consciously, paying close attention to the air in the tip of their nose, the sensation of the air going back through their throats, filling out their lungs, the sensation of the clothes, and the contact with their skin with every exhalation and every inhalation. That's precisely how I came to discover mindfulness meditation. I wanted so badly to be next to my daughter, but there was a judge and a court and an entire ocean, 5,000 kilometers, 3,100 miles between us. Through my journey, I discovered that unless you spoke English or French or lived in one of the richer economies in the world, not only did you have less options or materials to find out about the benefits of mindfulness meditation, but also your access to relevant, high quality information was just supremely diminished. That felt unfair. That felt deeply unfair. A study conducted by the WHO in 2017 found that in Latin American countries, mostly Spanish speaking, there are only between 2 to 6 mental health care professionals per 100,000 people. So I decided to do my part to bridge this massive gap between the needs of the Spanish population and the resources available to them in their own native language. And that's how Aire Fresco Mindfulness Meditation was born. In 2021, January, our first clinical study was published with amazing results. With only 14 days of using our app, people were more creative, reduced their negative emotions, had more empathy, but most important of all, they were more satisfied with their own lives. So I want to invite you to join us in this journey to build a more resilient, mentally healthy society and bridge that gap, that inequality, to bring science-based tools to those who need it so desperately, but often are made to wait longer than necessary. Thank you.
As I mentioned before, Victor is here. So if anyone had any questions or wanted to connect with him, feel free to put that in the chat. Let's see. Up next is Pear Team and Cassie Choi. She's also here.
I'm Cassie, the co-founder and chief operating officer of Pear Team. I'm also a registered nurse and a proud Husky. Pear Team is the first remote care team and automation platform for Medicaid. Today's Medicaid value-based managed care programs are suffering. Not only are our states' budgets buckling, but the programs to deliver this care are fundamentally flawed. Health plans are trying to pass data onto their provider networks about which patients need care, but all they're doing is passing along administrative complexities to a group already burnt out and under-resourced, leaving patients lost in the system. That's where Pear Team comes in. We're a tech-enabled remote care team that wraps independent primary care clinics and FQHCs with operational support to succeed in value-based Medicaid contracts. When 1 in 5 patients in the United States receive health benefits from Medicaid and 1 in 11 receive care from FQHCs, creating this infrastructure to support care is crucial. Clinics struggle to engage Medicaid patients, but our white-labeled care team does proactive outreach via text, email, and phone calls in our patients' preferred languages to build relationships with patients and their local health centers. We prioritize our outreach to patients based on clinical impact that will also drive the most revenue to our clinics based on their managed care contracts. We help patients complete pre-visit prep and after their visit, support them with scheduling lab appointments, mammograms, and more. We provide a tool that lives on top of the EMR to surface care recommendations, automate documentation and billing, and allow for one-click ordering back to our care team for care coordination after visits. We ensure that providers don't have to change their workflow to close key care gaps, but instead capture efficiencies to build relationships with patients and reduce burnout. Our data collection allows clinics to predict revenue and allows for health plans to capture real-time care gap closure ahead of claims data submission to improve their quality programs for their network. And although our results are just starting to come in, they're meaningful. After launching in August of last year, we were able to triple preventive visits and increase quality scores and thus clinical revenue by 16%. We saw a workload reduction at our clinics of 1.5 FTEs per provider, which is meaningful. These clinics can now focus on COVID vaccinations in their communities. And we're excited for 2021, where we're on track for a 40% improvement to quality score and revenue for our clinics. Pear Team's mission is to simplify healthcare for patients, providers, and health plans. By being a tech-first solution, we're able to enter a market that is in desperate need of innovation to support vital clinics that serve our most vulnerable neighbors.
I thank you, Cassie. I know Cassie is here. So again, if anyone wants to reach out to Cassie or Victor, the next two that I'm going to show are in a different area. One is Orion Wilmerding, who is a Northeastern alum. He's the co-founder of BurnCam, which is a telemedicine solution for burn care. Burns are common, but specialists are rare. With just a photo taken on their app, BurnCare's AI analyzes their burn injury, giving local providers critical information to decide treatment, as well as connecting with specialists. You'll see more in the video. And Orion is one of our health sciences entrepreneurs mentored ventures. So we're very close to Orion and his daily pursuit of moving this forward. And then we have Laura Kleinman, who and RebootRx. So she's the founder and CEO, and this tech nonprofit startup is dedicated to fast tracking the development of affordable cancer treatments using repurposed drugs, repurposed generic drugs and AI technology. So I'm going to show you those videos, and then right after that, we'll be moving into our breakout session, number 2.
My name is Orion, and I'm a founder of BurnCam Medical. We are an AI telemedicine platform tailored for burn care, equipping providers with the tools for evaluation, monitoring, and follow-up, as well as access to burn specialists. Burns are common, and it just takes one everyday moment of inattention for someone to go from the kitchen to the emergency room. The trouble is, most emergency room providers just aren't equipped or trained for burn care. Locally, you have just a 50% chance of getting the correct treatment path. That's a coin toss, risking over triage, which wastes valuable resources, and under triage, which increases your risk of scarring, infection, or death. BurnCam changes this story. With our AI telemedicine app, we bring the specialist to the emergency room at the start of care. We're with the patient through transfers, helping providers communicate and monitor the wound, and we're in the patient's pocket as they leave the hospital to continue recovery at home. Our simple, secure app makes it easy for you to connect with your providers, and easy for your providers to consult on your case using chat and video. This also includes quick, secure image sharing that can supplement or replace routine checkups, increasing patient compliance. And lastly, our proprietary AI analyzes injuries for key burn characteristics, equipping providers with the information to choose the right treatment path. I became part of the burn care world in 2017 as a co-op developing RSI's Wound Care Lumina Bandage. There, I got the chance to change a handful of patients' lives, and I came up with the idea for BurnCam as a way to reach more of the 500,000 people seeking burn care in the US each year. Our goal is simple: make life-saving expertise readily available where it counts, whether that's a big city like Boston, where a burn surgeon is just a couple of bus stops away, or a rural community like my hometown, where those experts are nearly 300 miles distant. BurnCam supports patients and providers every step of the way, from triage to recovery.
And the other video you want me to run is the RebootRx.
Yes, please.
Awesome. Let me pull that one up. There we go.
I'm Laura Kleiman, and I'm the founder and CEO of RebootRx. We are the tech nonprofit startup dedicated to saving the lives of cancer patients using repurposed generic drugs and AI technology. We're identifying the most promising drugs and developing new models for funding clinical trials so we can get these treatments into the standard of care for cancer patients.
I can tell you a story from just an hour ago where I learned some incredible news from one of our team members. Her father has been suffering from a type of leukemia, and then he received a repurposed drug called Atra. It's a type of vitamin A that was originally developed to treat acne, and he's made remarkable progress on a successfully repurposed therapy and is now cancer-free. And that's exactly why we do what we do every day. Right now, drug development is driven by profit motives. And then the public isn't yet aware that there are all of these opportunities to improve outcomes for cancer patients that are hiding in plain sight. And we need to raise awareness that the newest drug isn't necessarily the best drug, that there might be very effective therapies that already exist. There's no funding for the clinical trials that are needed to prove whether or not these drugs are effective for treating cancer. And government and cancer foundations don't fund these trials. So our organization is working to solve this problem and to get these treatments to patients around the world who could benefit from them. My motivation for starting our organization stems from both my personal and professional experiences with cancer. I've had multiple friends and family members who have suffered from cancer, and I lost my mom to a blood cancer called multiple myeloma. While she was fighting cancer, I was also having a career as a cancer researcher at the Dana-Farber Cancer Institute, where I realized that there were many opportunities to improve outcomes for cancer patients for a very minimal increase in cost with these repurposed drugs, but no way to get these treatments to patients. And then through my work at Dana-Farber, I realized that there was a way to accelerate the repurposing of these drugs using new approaches like artificial intelligence and machine learning. So I saw the opportunity as well as the need. We just need to think outside of the box. We need to come up with innovative approaches to scale generic drug repurposing and get more affordable treatment options to patients more quickly.
Thank you, Mike, for helping out there. We're a couple minutes behind on getting to our breakout rooms, which we'll be sending you to in one moment. I just want to thank our startup founders for participating in this event, and so pleased to showcase, as I mentioned before, they're here. So if you want to reach out to them directly, if anyone has any insights or want to connect, please do so. With that said, I will be putting up a screen as to where all the breakout sessions are, sending our the people who are recording the sessions and our lead discussants to those rooms right now. I'm going to open those and I'm going to put up my screen. So if you have any questions or if you need help like before, I'll help put you into rooms if you can't do it yourself. So enjoy.
Welcome back, everyone. I hope you all enjoyed the afternoon. And what I'd love to do is sort of popcorn style, see if we can get some insights, share outs, and then I've got some questions to lead us throughout the way. But it'd be great to kind of get an idea at pulse, no pun or pun intended, I guess, of how those breakout sessions went. What did we learn? What is there still to learn? Where can we draw from the breakout session that you had in the first one that you went to and the second one you went to? Are there certain concept themes? Certainly I was popping into some of them and I heard about data, but I'd love to hear about other things that came across throughout the day today and ways in which we can collaborate together and provide a hub for you all to continue to have this dialogue that started today and sparked today. So I think this is a time where we can kind of go open mic unless you're having a conversation with someone else. But it's great to see your faces and hear your voices.
I was just, it's Carolyn here from the School of Nursing. I think we talked in our breakout session a lot about frustration with the silos of professions and some comments about the need for more sort of technological sophistication in nursing. I think part of that's generational, and we certainly within our curriculum, there are informatics competencies that are built in. But what I walked away thinking is, I'd love to hang out with the engineers a lot more. I think we need to get really into these conversations and not some cursory conversation about coding, but really so that we can have all speak the same language. I think there's a lot of opportunity. I see Carmen there. Carmen, we have to redo our curriculum some more, but I think a lot more cross-pollination.
Also, it feels like many times when you get people from different perspectives into the room, it's just like people that are not in the healthcare domain themselves are looking for big problems and interesting problems to solve. Yeah, and there's plenty. And I think from our perspective, we're not necessarily going to solve them from the healthcare perspective. So you need that partnership. And that's really what part of these kinds of meetings are all about. So other themes that came across, I mean, we had very disparate kinds of topics that we were talking about today. Love to hear from others.
Also, I just want to point out that I think there were designated people to do some readouts. So feel free to jump in right now to actually do that. So.
Anyone? So should I call on people? Jake, how was yours? How was your session?
Oh, both sessions were really great. I think just coming out of the last AI session, I think a lot of synergies across health systems and some of the challenges in the way that we're approaching things between Boston Children's, Maine Health, and MGH, which was very, very interesting. I've had a lot of conversations in the AI space broadly recently, and I think a consistent theme has been, no one has really cracked the code completely, and I don't think it's, I don't think I've talked with any system really where AI has by any stretch reached the pinnacle of what it could offer and provide. But I think the first steps that everybody seems to be taking are, really attacking the low-hanging fruit use cases that can demonstrate some relatively quick ROI, some kind of no-brainer operational changes that AI is not the solution for, but it's a means to help guide that change management process.
Can you give a couple examples of like the low-hanging fruit and the things that you guys are all working on that it's a common kind of attack?
Yeah, absolutely. So one we're working through right now, pretty in depth, is medical coding. So helping medical coders be more efficient and actually tangentially to that, there's really a treasure trove of data and insights within unstructured data in the EMR. So think like the clinical notes, et cetera, things that typically would require a human to really sift through to understand. So we're seeing a lot of potential for unstructured data, not only in medical coding, but really with the opportunity to kind of leverage unstructured data at enterprise level, enterprise level analyses. Some other use cases we're really seeing as well in RPA and automation with prior auths, reviewing resumes on HR. So really a wide smattering, and we've had conversations throughout the organization, but really that consistent theme of where can we find these low-hanging fruit use cases and demonstrate ROI.
Great.
I think too, if I can piggyback off the artificial intelligence discussion, we just had the second breakout session on AI and drug development, and there are sort of two major sort of areas. One is in the lab and trying to come up with better compounds, better drugs, more efficacious targets. And the second was really, we had some interesting discussions on how do we apply it for medical data, where there is a lot of opportunity with, say, even post-marketing or real-world evidence. However, there's also privacy considerations, right? There's consent to privacy considerations for mining this data, and finding that right balance in a regulatory framework seemed to be one of the next obstacles for full utilization and deployment.
Yeah, we were talking to small companies, startups today, and then we were also talking about larger, bigger companies, and sort of there's different struggles and different kinds of areas where you can focus depending on your size and depending on sort of the breadth of what you're covering as well. So what Google can do and what an accelerator can do versus what a startup can do. So really fascinating. I'd love to hear some others from like maybe the digital health and physical rehabilitation. Can we hear what you guys talked about? The common themes.
I can jump in. I know you plugged in the accelerator world there, but in terms of the digital health accelerator group, Varun and myself met with a group, and we were just talking about kind of A, what is an accelerator, B, why an accelerator, and really C, how or what can you get out of an accelerator. And we kind of broke it down into, as an entrepreneur, whether you're in that discovery stage of really just kind of flushing out your idea, there are programs that are tailored to do such that, be it more incubator focused, or if you're focused on really kind of validating your product or business model or looking to become investment ready, there are also other programs, more accelerator like J Labs, that can equip you with the resources, the lab space that and ultimately enable you to do that. And then if you have a startup that might be more what we call at MassChallenge, enterprise ready, there are programs that really help facilitate strategic conversations about enabling solutions to be connected with specific enterprise partners. So we really enjoyed our conversation, just kind of educating everyone about the accelerator space. And I guess the key takeaway for the group is just that whether you're an entrepreneur with an idea or an entrepreneur looking to scale your business, there are resources and there's programs out there that can enable you to do that.
Great. Yeah, what would be really interesting is to hear from the legal, breakout group. There's a lot of sort of different perspectives that we wanted to bring to the table here with this theme along AI and health and well-being. So I'd love to hear any things that came up in those conversations, because really what we're thinking about is that AI is such a broad term, and so is health and well-being. And how are the themes of AI sort of really cross-secting or intersecting with these areas? And so I'd love to hear what some of those conversations were like and ways in which together we can solve very big problems. We know that this year there's been at least a deeper focus, I'd say, than before on diversity, equity, inclusion than in the past. How do we really get at the meat of those really, really tough questions?
So Candace, maybe do you want to talk about your session?
Yeah, I was one of the lead discussants for the session on IP issues in AI and digital health. So we had a lot of good topics. Actually, some of it was sort of directed kind of like patent strategy, like how would we go about tackling protecting certain features of your invention, patents, or some other form of IP like trade secrets. So there's an interesting question that always comes up in this space, which is, should I file something, file for protection through patents or keep something trade secret? Kind of the trade-offs of those, the considerations involved in that. One area of law that's particularly relevant for this space is also the question of whether abstract, if you're trying to patent an algorithm or some kind of software, whether that is actually patent eligible subject matter, because there's a lot of anxiety around whether certain things like algorithms or other kinds of software are even patentable, or whether they're just going to be struck down as abstract ideas. And so the short answer of all of that, or the summary takeaway, is that the law is in flux. There is some guidance that's been given to patent examiners that provides a framework for us, as patent attorneys and patent counsel and agents and such, to understand or predict how to kind of navigate that space. And some of the practical takeaways for applicants to understand is, it's helpful to be able to frame your software or your alleged abstract idea in terms of whether it provides an improvement in technology, like computer technology. Does it make something more efficient or easier to use or faster in some way? Or in particular for the digital health space, if there's something that we can do to say that there's a practical application of that alleged abstract idea, like affecting a treatment or prophylaxis for a disease or medical condition, that can be helpful to kind of overcome what the examiner might say in terms of saying that your software is not patentable. So it's not really end of the road. There's no blanket statement that's accurate if you're trying to say all software is not patentable. It's really kind of a nuanced question, and that area of law is always in flux. And there's a lot more that we can say on that, but hopefully that's sort of a good bite size for now.
Yeah, definitely. I mean, I think one of the key things as I was popping around to different sessions was I was hearing about the fact that a lot of AI today, especially that's used in health and healthcare, is not necessarily ready yet. And so and it's not about taking over, it's actually about augmenting and helping. So other themes, those things come up in other conversations as well, similar themes. Yeah. I'm looking to see if there's anyone else who wants to share out, otherwise we can wrap up maybe. I know it's been a long afternoon. I want to thank all of you for your attention and your time today, and actually in your participation in this. And that's really what makes Curated Collisions a successful event, is when you're all participating in the events and exchanging the ideas. So I hope you had the opportunity to talk to each other, to meet each other. There is a way to share your contact information. And then if you do want to share it, then we'll also share it with others. And that's a way to continue the conversations that were sparked today. We hope that you'll be able to do that. Stay tuned for our next Curated Collisions. We haven't quite decided on the time and the day yet, but we hope that that would be later this year. 2021 is fast flying, I think. My last thing that I wanted to just mention today, and see if you guys, if anyone actually is interested in this, that would like to ping me about this later on at my email at r.patel@nu.edu. We're together with the Curated College of Health Sciences, we're coming up with a new type of Health Leaders Fellowship that would be for those who are at their inflection point in their career, thinking about more leadership opportunities, thinking about the really challenging opportunities that come up when you're thinking about health implementation, whether you're in a hospital, whether you're in a tech company, whether you're in a startup and so on, where you have to deal with issues of legal issues, you might have to think about ethical issues, you have to think about operational issues. All of these things are tough, and actually sandboxing those and having an opportunity to talk about those with colleagues and learning the skills, the tough skills to actually figure out how you'll deal with them in real life scenarios, almost like a simulation before the real thing. It would be a one-year fellowship that you would be invited to, around 8 months of fellowship actually, that you'd be invited to. And it's really for those who want to take their career to that next level in health leadership, for thought leaders. So if you're interested in that, please reach out to me. My email is readily available in all of the communications that you've all had. And I hope you will give us some feedback on Curated Collisions. This is just our second event. We had some technical glitches today, but overall the level of conversation and the energy was exciting. So I hope that you enjoy the rest of your summer. And thank you all for your attention and your time today.